Ladies and gentlemen, thank you for standing by. My name is Daphne Worrell, Marketing Manager for ODG by MCG, and I'm excited to welcome you to today's webinar, Introducing the New ODG by MCG. During this webinar, all participants will be in a listen-only mode. If you'd like to ask a question, please use the chat feature located in the lower corner of your screen. We'll save some time at the end for questions. Any question that we don't get to, we'll respond through email following the webinar. This webinar is being recorded, and the recording will be sent to you within 1 week. Our presenter today is John Nelson, Director of Sales for ODG by MCG. John has been in the insurance and healthcare industry for over 20 years. With expertise focused on where healthcare delivery intersects with technology, specifically in the areas of workers' compensation, disability, and absence management, John has built solid relationships and helped operationalize evidence-based return-to-work and treatment guidelines solutions with some of the industry's largest insurance companies, hospital systems, third-party administrators, employers, and governments across the world. John has a strategic focus on data analytics, benchmarking, and decision support and integration of ODG within claim systems. John, you can take it from here.
Hi, Daphne. Thank you for the introduction. And everyone, welcome to today's webinar. Let me share my screen here. Okay, so hi, my name is John Nelson, Director of Sales for ODG. I will be the presenter for today's monthly intro to ODG by MCG. As many of you already know, in January of 2017, ODG was acquired by MCG, which is part of the Hearst Health Network. Early on, we knew one of our strategic initiatives and major investments was to upgrade the ODG website. We have received an overwhelmingly positive response to the new site, and some of the feedback is that the site is fast, intuitive, actionable, configurable, and contains more functionality than our legacy site. We will keep both applications or websites running simultaneously, but we do plan to sunset the legacy version of ODG sometime in 2020 in hopes that most of our customers have migrated over. The goal of today is to provide a comprehensive demonstration of the new platform. I will start with how to search the guidelines, but then I will pick a medical condition and run through the various tabs, duration or return to work guidelines first, our new tool, the job profiler. Then we will talk about cost, followed by the treatment, the towel, and the formularies. Everyone will be in listen-only mode, and I can take live questions at the end. As you can see from the home page, at the heart of the site, we will still provide the 3 core components of ODG: evidence-based duration or return-to-work guidelines, evidence-based treatment guidelines, and the cost tab. All 3 of these are very interrelated in that the longer a case goes on, typically the more the claim will cost. The functionality tabs all correlate with the 3 major components, and green check marks will appear where we contain information. The modern design takes on a tabular approach, and we architected the website with the deep linking theme in mind, where we present the most important information up front with the ability to dig deeper if time permits. I always like to commend the front-end users on the phone today, as we understand you have very busy workloads and need to find information readily. Human intervention, or what you do on a daily basis, is the most important part of this process, and guidelines can be used as a framework of dialogue to get everyone working towards common goals and expectations, which is to help people back to functional improvement. With that said, let's go ahead and just start off with how to find or searching information. I'll go ahead and provide a few examples here. Everything really takes place from the search bar here, and I'm going to, again, just give a few examples. So you can start typing in the medical topic name. So for instance, you could type in carpal tunnel. The more you actually know the condition name, the better we can predict out below to what you're looking for. So you'll see we have 2 results under the duration tab. Again, you'll also notice the green check marks in the functionality tabs located here: duration, treatment, towel, formulary, cost, and job profile. And then below you'll see the results, which you can collapse and expand. Just to give you a few more examples, you could type in depression. You could type in hip replacement. You could type in an actual surgery like laminectomy. Again, the more that you know the actual topic or medical condition name, the better it predicts out. If you are looking for physical therapy for low back, you could type in physical therapy, and then you'll see it's going to bring back the treatment parameters for physical therapy. If you don't know what the actual condition name, you can do more of a broad brush search by body part. So for instance, the word back, and you'll notice it's going to give you a little bit more of a corresponding result. In here, you could also type knee, elbow, etc. If you come up to the top here underneath the Codes tab, you can click on this arrow key here, and you'll see you can also insert or check ICD-9 or ICD-10. It automatically defaults to medical topic. And just to show you a few examples, you can type in the ICD-9 code of 354, and it brings back the corresponding list of results with the ICD-9 codes. As an example, for ICD-10, you can type in G56. So again, in here, by checking off the Codes tab here, you can search by medical topic name, by ICD-9 code, by ICD-10 code, by CPT code, by NDC code. And the more you actually know the condition name, the better off we can predict the results. And then you'll see green check marks highlight the functionality tabs where we contain information. Again, one of the real goals we were trying to achieve with this site is to create adoptability amongst our end user groups. So you'll notice we have top 10 to 15 return to work diagnoses, top 10 to 15 medical treatments. In the near future for groups, we're looking to be able to configure a customized list. So if you find that these are kind of varying or not or different from your top conditions, we can look at replacing these and inserting some of your top conditions. These are all quick links. We also have an anatomical design of a human body here which contains yellow nodes. So if you hover over these is going to link you to the treatment index. So for instance, if we were to click on low back, it will take you to the low back chapter where you can find all the treatment guidelines. Again, I'll get into or elaborate on this in more detail when we get to that portion. You can get to the home page by clicking here on the ODG by MCG logo or home. I simply click there. Just going down, you'll also notice the workers' compensation guidelines by state. So we contain a few of the states here, and you can click on these and it will give you their state treatment guidelines. Okay, so with that said, I'm going to go ahead and just pick a condition like back sprain. And what you're going to notice is it's going to open up the duration tab. So you can see we're on the duration tab now, or the return to work guidelines. You'll see the condition is pinned up in here in green, and you'll also notice the condition here. We're going to give you a short definition or injury of the injury or illness. And then you're also going to see two time frames, point A and point B. And I want to take a few minutes just to elaborate on these. These time frames here, as ODG has been the leading publisher of evidence-based guidelines for the past 22 years, we've been collecting and synthesizing ongoing data, or we collect de-identified data from primarily insurance companies, TPAs, state funds, governments, providers, self-insured, self-administered employers, and they go for the ongoing development of our guidelines. What we're doing in point A is we're showing users what's likely to happen in the real world based on the data that we've collected. From a very broad or a high-level overview, though, there's two contributory factors to this time frame of work, the 19 days that we're looking at here. There's the medical contributions, but also I'm sure that everyone is very familiar in the room here with the non-medical factors that contribute to lost time in the workers' compensation, disability, and auto arena. So what we're looking at here is a contribution of both the medical and non-medical factors. So it's more of a starting point or a benchmarking. We wouldn't necessarily want to manage our cases towards this time frame. ODG has a world-renowned gold standard medical advisory board that reviews the real-world data that we collect, and in a modified Delphi approach, we ask them if they were to extract the non-medical factors, what does more of a physiological target look like? And that's what's rooted here in time frame B. So the way that we feel is if you break your bone skiing, you break your bone surfing, you break your bone walking down the stairs at night, you break your bone in a car accident, what we're trying to do is manage towards the healing time of that bone. So really, in a nutshell, what we're trying to do is get people from point A to point B. We may not be able to hit this point B time frame overnight, again, because it's reflective of those physiological healing times. But again, we're trying to manage towards functional improvement, help people back to their productive endeavors. It's okay if we don't hit this time frame because, again, we see what's likely to happen in the real world. As we've been publishing these guidelines for 22 years, we've been able to collect and synthesize enough data to really allow us to get from a diagnosis level like back sprain to what I consider more to a claim level. So what most of our users actually do is come up here and click on this refine button. I'll just point your attention quickly to this risk assessment score. You'll notice as I'm inputting information here in the refine, things are happening in the background and inputs are going to be changing here on the front end of the application. Very unique to the ODG resource. In the past, you've only been able to really search by sedentary, the Department of Labor job classes, so sedentary, light, medium, heavy, and very heavy. And as you noticed as I hovered over these, it's providing the definitions for the DOL job class. Very recently, we partnered with a company called My Abilities to bring in a job-based data bank of over 30,000 jobs where you can now actually search the job base. So I'm putting in the person as maybe a firefighter. It's researching the database. And when I click on that, what it's going to actually do then is it's going to go out to that database. Do that again, sorry. One second. Sorry, I'm not sure when it's populating from my screen here, so we'll just do that again. And when I click on firefighter, what it does is it kind of brings that information up. You'll notice down here in the job profile tab, now there's a green check mark box. So when I click on that tab, what it's going to do is it's going to actually open up the job profile. Right off the bat, you're going to see a demand score of 99. This means it's in the 99th percentile comparable to other jobs for physical, environmental, and cognitive demands. So that's kind of what we're seeing below down here. This is really important because we can also now see a description of the job. So if you open up this button here, it provides a full description of what the person actually does. You can share this job profile. Again, you'll see the physical, the environmental, and the cognitive demands listed down here below, so talking about what they do. Also, though, we can customize this. So if I hit the Customize button here, and I'm just going to type in XYZ, the email address. I have one kind of ODG. And then we put in just a first name and a last name, and we hit Confirm Owner. You'll notice it's going to go out to the database. It's going to bring some information back here. And now you'll notice there's going to be an Edit Mode button here. And once we click on the Edit Mode, what that will allow us now to do is to actually customize these job demands. So we're looking at a firefighter. For instance, if we wanted to look maybe at climbing, we can click on that. And then you can see we can customize this. We can save this. You can put the distance in. So you can actually customize this if you have a better idea or description of what that person's doing. If I were just to cancel that out, you can also add a physical job demand here by clicking on any of these. So for instance, if you clicked on walking, you can see the frequency and the distance and so forth. So right from the get-go, and I'm just going to go back to the duration tab. Remember, these are all working simultaneously in the back. What I did was we started off with a back frame. I clicked on Refine. It allowed me to come in here and either choose the Department of Labor or the actual job. And now we can kind of get a little bit more granular again to the claim level. So we can put in the state California. We can put in, let's say, the person was 45. We can say the injury happened on May 2nd. And so what it's going to do is it's automatically going to calculate 22 days from May 2nd. So it's going to give us a target return to work date. We can also parse by our claim type then, workers' comp or disability. For the sake of this demonstration, I'm just going to keep it as any. And then what we have is 9 confounding factors. These are what we find are some of the most impactful as well as some of the most frequently seen. And these are also going to go to kind of impact the duration. So we could say maybe the person had hypertension and also depression. I want to point out really quickly here, though, that you're not limited to these 9 confounding factors. What we can also do is come up here and insert or just start searching. So let's look for carpal tunnel, and let's say they had carpal tunnel release surgery. So you can also choose that topic. So now we see 2 conditions pinned up. We're going to see multiple conditions below, and now we're going to see the point A and the point B. Remember, these time frames are very important. Again, point A is what's likely to happen in the real world. Not generally the outcome we're looking for, but good to understand here is what's likely to happen based on the 10 million lost time de-identified case data or the aggregate pool from ODG. Here is the physiological targets, what we're shooting for. So again, if we don't hit the 105 days, but we were to get someone back to work in 120 or 130 days, you can still see we've done a fine job on this case. So again, getting people from point A to point B. I always like to point out here that ODG is not just an encyclopedia reference tool for a lookup, right? I mean, this is really good for decision support, business intelligence, analytics. Some of the things that we can do here is we can actually benchmark our results against this big national average here, this big data pool of guidelines. Many of the big companies are also kind of using this to see, which people are getting folks back to work in the time frame suggested, treating within evidence-based treatment recommendations. You'll notice down here, we believe in human intervention. So if you think one of these scenarios better describes the patient you're working with, you can choose it, it will highlight it, and it will put it into the guidelines up here. Remember, human intervention is the most important part of the process. We're also going to have ICD-9 codes that are related, ICD-10 codes that are related, and then we also have these capability and activity modifications for restricted work. So talking about things this person will be doing in a regular work role, lifting, stooping, standing, squatting, repetitive motions, and then also in a modified work role. These are also very specific to the condition or medical topic we're on. I want to come up here because I point your attention earlier before I hit the refine button to this risk assessment score. This is probably one of the most widely used or adopted functionality tools with an ODG, because what it's doing is providing users with a visualization of the complexity of the case or claim. It allows organizations to get the right people on the right cases and the right claims at the right time. The higher the score goes on the thermometer, the more likely it is to have a longer duration and a cost associated with it. A lot of companies kind of generally set 60 as the threshold. It's really kind of also used for interventional triage. So right now I am showing you the online application of ODG. We also have a gold standard suite of web services where you can integrate this information into software systems, claims platforms, electronic medical records, risk management systems. And then what you can do is you can actually triage these cases or claims based on that risk score. So if it goes above a certain number, you might decide you want to have a more experienced case manager on it. You might decide you want to go out to an IME or a peer review. So again, it's giving you an indication of the likelihood of the complexity of the case or the claim. We also have a timeline located right here. And in this timeline, we're kind of giving you general ideas of what's happening throughout the case. So you can see on today's date, you'll notice here's the best practice time frame. Here's the average time frame. We also suggest sending a return to work prescription. So we highly advocate the dissemination or the sharing of this material. So once we have all of this really nice content, what do we do with it, right? There's a lot of people involved in these cases. You have the employer, the doctor, the case manager, the nurse, everyone, right? So again, we promote the sharing of it by clicking on return to work prescription here, or underneath the print button, we can actually print the page, which puts it into a PDF here. Or what we can do is actually underneath here, we can click on the return to work prescription. And for the sake of time in this demonstration, I've already populated some forms. So let me just show you what it looks like. So by clicking on return to work prescription, it goes ahead and it brings up some information where you can input these variables in. Again, I've already done this, so let's just take a look at the one I have open. And what it does is it puts all that information into a very nice, succinct, and clean form that you can then share with stakeholders. Going to the customized, kind of the configuration of this, a lot of companies are asking to input their own company logos in here. These are all optional fields here, but you'll see what it's doing is it's giving you the job description, the definition. It's giving you some comments, some non-adversarial comments that say, please review and modify the enclosed ODG guidelines for return to work. We can also put a job function evaluation if you prefer that format. Real, again, open-ended, non-adversarial questions. It's bringing in the diagnosis that we were on, the return to work days, and those capability and activity modifications. There's really two strategies to deploy this tool, but what it's really doing is operationalizing the guidelines, right? It's exporting that material from the front page into a form, again, that we can share with various stakeholders. So the two real strategies to deploy here is, first and foremost, if we can use this early on, it helps set expectations, right, by providing this time frame. And again, we're not trying to dictate care. What we're really trying to say here is, Dr. Williams, we use evidence-based guidelines from ODG. We understand it's a guideline. We know people heal differently. It just looks like, we use the nationally recognized guidelines from ODG, which we have a short definition down here, unbiased, evidence-based. If you think we're going to go beyond this time frame, is there maybe something else going on with this patient that we're not aware of? And so that really, again, helps set that goal from the target. The other strategy to deploy is if we feel like we're going to go beyond this day or we're starting to approach it, you could use this again in that very open-ended, tactful approach to say, we're looking at evidence-based guidelines. It looks like we're approaching this. Is there maybe something else going on with this patient that we're not aware of? And again, it helps get the case off to a good start. You really need some kind of a goal to shoot towards. And this is really a cover page. We also have a functional abilities form down here below where you can actually send this, and a clinician or a provider could actually start filling this out. And you could say, 50 days without restrictions, 35 days with restrictions, and then you can put the posture, the motion restrictions, the miscellaneous restrictions, and so forth. So again, it's a tool to equip or back the decisions that you're making on a daily basis using evidence-based guidelines, but knowing that it is just a guideline, right? Again, it's not meant to dictate care. It's meant to help work towards common goals, which is how people back to functional improvement. So coming back to the duration tab, just to start off, or just to kind of recap what we did here, we started off with a back sprain. We clicked on refine, which allowed us to get more to the actual claim demographics, right? What they actually do, the state, the age, the date of the injury, the claim type. Were there any comorbidities or confounding factors? It allows us to get durations at point A and point B. For those of you, we also have a configuration of the website where if you prefer not to see only average and best practice, you could also see the maximum, the average, and the best practice. So again, we have different views, and it's up to the user preference on what they want to see. But what we're trying to do is get people from point A, what's likely to happen in the real world, not generally the outcome we want to see because it consists of both non-medical and medical factors, and we want a case manager shoot towards this best practice time frame, which is more reflective of the physiological. We're also going to give you some information, referential or didactic information. So if you have time and you want to learn more, you can click on Medline Plus, or you can click on the actual carpal tunnel here, and we will take you and we'll talk about what carpal tunnel is. And it gives you a description, why the procedure is performed, risks, before the procedure, after the procedure, outlook. And you can actually email this information. You can print it. It's in Spanish. We've linked you to the appropriate topics within Medline, but you could also start typing in depression, or you could type in PTSD. You have access to this full clinical or content of library here of medical information. So just to kind of go back where we were, we also contain here, this was the Medline Plus. For those of you who learn better visually, we also actually have 3D animations here. So if you were to go ahead and click on this, they give you short 30-second to a minute clips, and then all you have to do is click here and it'll bring you back up. The last feature I want to show you on this tab here is the Return to Health tab. This is more of a consumer version of the guidelines. If you were to click on this and click on Open Return to Health, it takes you to a database that more in layman terms, but kind of what to expect and so forth. And so you can see it kind of brings in the days from ODG. It brings in some of the actual treatments that you can do. And when you click on these treatments, then it will open these up. And it kind of tells you, questions to ask the doctor, an overview, some exercise, and some things like that. So it gives just a consumer version the idea of kind of what to expect and some things to see when you're having these, trying again to, close the gap or bridge the gap on the stakeholders. So we've covered the duration tab. We've covered the job profile. While we're here, I want to move over to our cost reserve calculator. And so when I click on that, as I was entering in information up here, again, it was working in the background, and it's going to go ahead here, and it's going to give us information on the cost of the case or the claim here based on indemnity, medical, expense and administrative, and then the total cost. And you can see you can move these here to best practice, to claim typical. Most people use claim typical for showing what an average cost of the claim could be. If you're looking to demonstrate savings, you would use the claim max. But just so you know, on this feature here, since we chose California, it's taking in the average weekly wage of California. You can also override that if you know what the average weekly wage of the claimant is by typing that in here. It does also take into account waiting periods. And then also on the medical, we're rolling this up in the aggregate for the time being. One of the features we want to do in the future is being able to break this out a little bit more. But then you also see the expense and administrative. So this is, again, a lot of companies use this to maybe augment specific tools that they have, but just to find out an idea of the case or the claim. Coming back to the duration tab, that also factors into that risk assessment score. So that's 50% of the score is the magnitude, which is the cost and the duration. The other 50% of the score is what we call volatility, and that's the ability to capture a good outcome from a bad outcome. So again, giving you an idea of the complexity of the case or the claim. So we've covered the duration tab now, the job profile tab, also the cost tab. Let's go ahead and come over to the treatment tab next. ODG is world-renowned for its evidence-based treatment guidelines. We've been adopted in many states across the U.S. And again, we have a really extensive medical advisory board that's always consistently scouring the marketplace, looking for various different studies, randomized control trials. Again, what I think you'll find here is the way that we've architected the website is that if you look down here, it's going in alphabetical order. It's hyphenated to the body part chapter. But you'll see that we have these kind of, a green R would stand for recommended. And if you hover over that, it's going to give you the recommendation. CR stands for conditionally recommended. US stands for under study. NR stands for not recommended. And O stands for other. Again, if we want to go ahead and click on aerobic exercise, for instance, we can. What it's going to do is it's going to give you the procedure name here, the body system, the treatment type. Most importantly, it's going to give you a recommendation statement. So here's the recommendation statement. So it's saying it's recommended generally. And then if you have, here's the evidence summary. So again, if you have time and you want to learn more, what you can actually even do is click on these links. It will give you the evidence-based literature rating, and then we'll even take you out to the PubMed articles. Where here it gives you kind of a condensed version or a background and abstract of the article, but you can also get the full articles here too. So again, if you have time and you want to learn more, you can kind of see here, you just can deep link in. I want to come back here though, because ODG covers a lot of different injuries and illnesses and treatment guidelines here. If you look down, you can see it's going in alphabetical order, but you can see the breadth of this. What a lot of our clients end up doing is kind of a shortcut is you can filter the recommendations. So we can say, here's what's recommended, here's what's not recommended or under study. So let's take a look at what is recommended. Now you're going to see the various different categories. We'll take a look at two of these. We can see diagnostic testing, electric stimulators, imaging, implants, injections, medications, PT, orthotics, psychological surgery. Let's first start with PT. And now we're in the body system, low back yet, because that's the condition we are on. So if we scroll down here now, we see physical therapy, low back. If we were to click on that, it's going to open up and it's going to show you it's recommended. And now it's going to get into all the conditions. Lumbar sprain and strains, lumbago, intervertebral disc disorders, spinal stenosis. Again, coming down, here's the evidence summary. And then, again, you can click on any of these links, which will hyperlink you right into, for instance, the PubMed articles. And just coming back up here, the way that our philosophy on the physical therapy guidelines is, for instance, if we were looking at spinal stenosis, 10 visits over 8 weeks. If we're seeing functional improvement, fantastic. Let's keep going. If we're not seeing functional improvement, it may not help to get another 30 visits over 24 weeks. We may want to take a step back, see what's going on. Maybe there's something else going on with the patient we're not aware of. So again, our evidence-based treatment guidelines provide all these contextual links into the actual citations. But coming back here, from a clinician standpoint, if you wanted to see if you're in a state where it's ODG is mandated, for instance, you can see what's recommended. Let's take a look at surgery, for instance. And then if we want to see discectomy or laminectomy, we can click on that. And now you're going to see it's conditionally recommended prior that it meets the indications below, and here's the criteria for surgery. So again, a little bit more of that clinical algorithmic workflow here, and then the risk versus the benefit and the evidence summary. And if you have time, you can always click on any of these, which will link you right back into the PubMed articles. Just coming back to the treatment tab, there's one more spot here underneath treatment planning. This might be more for the clinical folks, but we can come here to low back. And what you're going to see here, again, the treatment planning section is not designed to be a rule. And so, ODG would never use the word deny in any of our products. So we're providing guidance based on evidence out there. We have, documents that can justify if if you need that kind of information, but you'll see here, what to kind of expect on the first visit, the second visit. So again, it's really tools and information to help back the decisions that you're making on a daily basis. So if I hit the back button, we come back to kind of where we were here. I'm just going to kind of take, let's go ahead and look at the tau index next. So the tau index, formerly called our UR advisor, is a mapping between diagnosis, injury, and treatment. And the tau index is used in combination with evidence-based treatment guidelines by ODG to improve the efficiency and effectiveness of return to work factors such as pre-authorization, utilization review, bill review, provider profiling by automating first-line approvals in many treatments. The tau allows you to query by ICD code, CPT, or a combination of ICD codes and CPT procedure codes. For each combination, it provides information on frequency, the number of visits, recommendations from ODG, and a tau score. So let's go ahead and take a look here. Right now we're looking at multiple conditions, but it's giving you, it's really a mapping again from diagnosis to procedure. It's based on over 5 million claims and over $19 billion of paid invoices. And we're going to show you the frequency of therapies or procedures for any given condition. So you're seeing the CPT code, the procedure name, the CPT group, the frequency, the median number of visits, average number of visits, cost mean, authorized visits, the payment flag. I'm going to get into this momentarily, but this is probably the most important section here, and then the tau index. If you click on this, it will open it up and it will give you more specific details. What I'm going to do now, though, is actually expand this to 50 results so that we can see the 4 different payment flag results because, again, these are some of the most important. You're going to see green, yellow, red, and black. And so green and yellow are more of an auto approval basis. Again, red is more of a route for review. So if you look at the green here, what that's telling us is it's backed by traditional evidence-based medicine. The yellow is a little bit more of a combination of evidence-based medicine and data-driven in that we see it with high frequency, low cost, and has a good return to work outcome. This is one of the new features of the UR advisor, which is the treatment analyzer. And what it's doing is it's measuring or it's correlating positive return to work with various different procedures. And it gives you a score of -100 to 100. So the higher the score goes, the more positive associated return to work timeframes or outcomes we have with this procedure. A red would mean more or less kind of route for a review, and a black would be more of a route for review with extreme caution. So again, a lot of companies automate this into their actual billing review systems or the UR process or their claims management decisions. So what they can do then is it gives them these timeframes right up front, automated procedures, pre-authorization, and so forth. The last tab I want to cover here is the Formulary tab. ODG has a very world-renowned binary formulary that has also been adopted by many states for workers' compensation. Again, it looks and feels a little bit like the tau index that we were on in that it's giving you a drug class, a generic name, an innovator brand, a notes field, does it have a generic equivalency, a status, and a cost. We typically find the status is one of the most important parts, and it's a yes or a no. So if you hover over that, it's preferred for use as a first-line medication under ODG criteria. An N would mean not that we would never see it, but it just means we may want to see some justification as to why we're seeing this medication or prescribing it. Underneath the drug class, you can search by the various different drug classes. So we can search by opioids here. And you can see the generic. If you want to look at any of these, for instance, you can go ahead and open these up, and they're going to go ahead and they link right back into the treatment guidelines. We have direct links right back into the contextual citations or the treatment guidelines. And then you can even click on these to click on Medline Plus. It provides you with an NDC code, the strength, the trade name, the effective date, and so forth. So just kind of coming back where we were, a lot of times in cases or claims, you might have patients who don't remember what condition they have, but they can rattle off every medication or injury they're on, or medication. So that might help you discover if there's something else going on with this patient that you're not aware of. For instance, if they're on Lyrica, you can click on this here, and you'll see what bring you into the criteria, the recommendation statements, and so forth. You'll see the Y in the end. I think we covered this a little bit earlier. Again, this is kind of the most important part for the first line treatment. The cost, does it have a generic equivalency, and then the notes field. Coming up here, we also have an opioid MED or morphine equivalency dosage calculator where you can input, maybe they were on 100 milligrams of codeine and maybe 60 milligrams of oxycodone. You can see it kind of brings up here maybe 20, right? And it gives you the ODG, the total daily morphine equivalency dosage, the ODG risk stratifications for dosing, and then it also breaks it down individually at the medication level. So kind of just coming back to the home page, I just want to kind of review what we went over in terms of finding information using the search bar. You can search by medical topic name, keywords, body part, procedures. You can use the return to work diagnosis list down here, the anatomical design. Again, if you're looking for treatments in low back, you just hover over the node. You'll see here it brings up the treatments in alphabetical order. Then you can filter these recommendations. If you were to click on aerobic exercise again, for instance, we can also see treatment info here, which goes over our methodology. If you ever need to document exceptions to the guidelines, you can look here. But just coming back to the home page on the search, everything starts there. You'll notice when you pick a condition, it's going to highlight the boxes where we contain information, so the duration, the treatment, the tau, the formulary, the cost, the job profile. You can refine those results, get more to the claim level by putting in the person's occupation, Department of Labor, the state, the claimant age, and then again, trying to get people from point A to point B, the risk assessment score, and so forth. We also have, underneath the help and training section, a really nice self-paced training webinar. But if you come back to the home page here, if you ever want a quick tutorial on any of these, you can simply click on the duration tab. And we're going to go ahead and we're going to show you here then a quick 2 to 4 minute clip on how to use the duration tab. And if you click on any of these actual functionality tabs, it will bring you into those associated various little short clips. So cost, formulary, tau, job profile. So thank you for your time. I'm going to kind of open it back up to Daphne here for any questions that we may have.
All right. Thanks a lot, John. That was great. Yes, I do have a question here. Is this only available as a web subscription, or can the data be integrated?
Yes. So again, we do have a web service or an API connection where we can automate our guidelines via XML or JSON into your actual claim system. So instead of having to swivel out to an online product, this information would actually reside within a case management or a claim system or an EMR. One of the nice things about automating this content is not only do you get some efficiency gains, but you also gain some business intelligence and analytic reports where you can benchmark your experience against ours. You can do some interventional triage based on the risk assessment score. So there's a lot of advantages to actually integrating this content for decision support into systems.
All right, thanks. Is further training available for my staff?
Yeah, so ODG, everyone will have an account manager or account manager group associated with them. We also have various, you can see underneath the help and training section here, we have a help desk, we have information guides. But if you would like a more personalized tutorial where we can actually, walk through a topic, do some live question answers, feel free to reach out to your account manager or the actual help desk, and we can set that up.
All right. And it looks like this one came in as a follow-up to that first question. Is the API changing with the website change?
Yeah, so the API feeds, we have a web services manual that consists of multiple pages on how to connect to this. It would really depend. We should take a look at that, and please, for the person who asked that, please follow up with myself or Daphne, and she can connect you to me. But yes, we should take a look at that because there also might be some deep linking from your system that might be linking you to the legacy version where you might want to link here to the new version. So we should probably take a look at that. And the API feeds, what's really nice about that, sorry, I should have expanded on that a little earlier, is you can decide to show your user groups whatever you like. So you don't need to integrate the entire content. If you want to just integrate the return to work timeframes, you can. If you just want to integrate the TAO or the UR advisor, you can. You can integrate just the reserve calculator. So you can really take bits and pieces of information, embed it into your workflow, and display what you want, when you want, to those specific user groups.
All right, great. Looks like this is the last question. Does the new interface offer deep linking by diagnosis code and single sign-on?
Yes, so we can certainly set that up. Right now it kind of has, if I were to log out here, it has a user ID and a password. We're able to provide you with one link that you could install on an intranet system, a case management system that would log you right into the home page, bypassing the user ID and password screen. But we also have more of a kind of as an iterative approach, or one further step from that. You could also link from a specific condition within a system. So for instance, if you were on back sprain in your case management or claim system, we could link you to the appropriate page, back sprain, right within this ODG website.
All right, great. Thanks, John. If you want to kick it back to my screen, I can put up our contact information. And let's see here. There we go. And thank you, John, for the very informative presentation. Thank you, everyone, for your attendance and questions. You are welcome to contact our help desk at odghelp@mcg.com, or if you respond to any of your invite emails, you will get in touch with me, and I can put you in touch with John if you'd like. And thank you, everyone, and have a great day.
Thank you, everyone. Bye now.